Are you a stressed out nursing student? Do you find yourself laying awake at night worrying about all the homework you have to do and medications you have to learn? We've been there and understand the struggle, which is why we are coming to your rescue. Sit back, throw up your feet, and hold on tight because we are here to make autonomic nervous system drugs easy in 3, 2, 1. Let's start with what the autonomic nervous system is. The autonomic nervous system is part of the nervous system that controls and regulates the internal organs without any conscious recognition or effort by the organism. It is comprised of two antagonistic sets of nerves, the sympathetic and parasympathetic systems.
Have you ever had a patient with excessive secretions? The drug category you would want to use is anticholinergic drugs. They work by blocking the action of acetylcholine. Acetylcholine is a neurotransmitter and a chemical messenger. An example of anticholinergic drug is atropine, also known as atropine. It is administered using sub-Q, IM, and IV. It works by inhibiting the action of acetylcholine. It is given preoperatively to decrease oral and respiratory secretions, to treat bradycardia and heart blocks, and also treatment of anticholinesterase poisoning. The dose ranges from 0.4 to 1 milligram. Side effects include dryness of mouth, blurred vision, photophobia, tachycardia, palpitations, dilated pupils, hot, dry skin, thirst, and dizziness. Nursing implications are to assess vital signs, monitor intake and output in elderly or surgical patients because atropine may cause urinary retention, auscultate bowel sounds, and assess patients for abdominal distension. Teach the patient that the drug may cause drowsiness. Instruct patients that oral rinses, sugarless gum, or candy, frequent oral hygiene may relieve dry mouth, and also notify the doctor of any new medication started during therapy. The average cost of the drug is around $30 per vial.
Have you had a test question come up about a patient with glaucoma and found yourself caught off guard? The drug category you will be interested in is cholinergic. Cholinergic drugs enhance or mimic the action of the neurotransmitter acetylcholine, the primary transmitter of nerve impulses. A drug that falls into the cholinergic classification is pilocarpine, also known as diocarpine. This drug stimulates cholinergic receptors, including stimulation of the exocrine gland. In other words, stimulates the outflow of aqueous humor. This drug can be given as eye drops and can be given up to 6 times daily. This drug costs $143 a month. Some nursing considerations are to assess oral mucosa for dryness and ulceration periodically throughout therapy. Some side effects that the patient may experience include headache, rhinitis, hypertension, flushing, tremors, chills, voice change, and tachycardia. You should instruct the patient to take this medication as directed and advise them to drink adequate daily fluids.
There are a lot of test questions regarding patients in shock. Adrenergic drugs are the drugs used for shock. They work by stimulating the same nerves by either mimicking the action of the neurotransmitter norepinephrine or stimulating its release. An example is dopamine. Dopamine, also known as entropin, is used to treat patients in shock. It is used to treat low blood pressure caused by conditions relating to shock, such as heart failure, kidney failure, a heart attack, or trauma. Side effects include headaches, arrhythmias, hypotension, angina, and ECG changes. It can only be given IV. Dose ranges from 5 to 15 micrograms per kilogram per minute. Some nursing considerations are to monitor vital signs and ECGs. If hypotension occurs, administration rate should be increased. If excessive hypertension occurs, rate should be decreased or decreased. Advise the patient to inform the healthcare provider if chest pain, dyspnea, or numbness occurs to the extremities. The average cost is $140 per 300 milliliters.
You find the stress of nursing school has caused your blood pressure to shoot sky high and landed you in the doctor's office. One potential drug category your doctor may turn to is adrenergic blocking drugs. This category is broken down into alpha or beta blocking agents. Metoprolol or Lopressor is a beta blocker that fits into this category. The cost is $23 per 30 tablets without insurance. The action of this drug blocks stimulation of beta-1 adrenergic receptors, which will decrease blood pressure, heart rate, and the rate of cardiovascular mortality and hospitalizations in patients with heart failure. This can be administered either orally or by IV. The dose depends on which route it is given. Some side effects include fatigue, bradycardia, increased liver enzymes, drug-induced lupus syndrome, and pulmonary edema. Some nursing implications include monitoring blood pressure, ECGs, I&Os, daily weights. Some signs and symptoms that the patient should look out for include heart failure, an elevated BUN, and uric acid levels. If the apical pulse is less than 50, hold the medication. Teach the patient that this may cause drowsiness and to not abruptly withdraw themselves from this therapy. Advise the patient to change position slowly to minimize orthostatic hypotension.
Now that we have expanded your knowledge about the autonomic nervous system drugs and simplified how everything works, you can rest easy knowing you won't be caught off guard on your next pharmacology test or the NCLEX when these pesky medications pop up.
That was easy.